Hey, my name is Davis Rogers. I'm one of the new surgeons at Alabama Bone and Joint Clinic. My primary focus is hand and wrist, although I do a variety of procedures in the upper extremity and elsewhere in the body. Today I'm going to discuss with you one of the most common conditions that I see, which is called carpal tunnel syndrome. Essentially, carpal tunnel syndrome is a fancy name for compression of the median nerve at the level of the wrist. And the median nerve is responsible for sensation for a significant portion of your hand, as well as some of the function of your thumb. Commonly, patients will come to me in clinic and say that at nighttime or in the morning they have this sensation of numbness and tingling. It sometimes wakes them up. Some people say that it happens while they're using the phone or maybe driving a car or other activities of daily living. There's a variety of treatment options. We always try to start very conservative. So usually I'll start with nighttime wrist bracing to see if we can decrease the compression on the median nerve and allow it to calm down. If that doesn't work, we have the option of doing a corticosteroid injection in the area of the carpal tunnel to help decrease the inflammation around the median nerve. Sometimes I use a diagnostic study called an EMG/nerve conduction study to help delineate where exactly the compression is happening and help me know that it's happening directly at the wrist over the median nerve. And then lastly, if nothing else is working and the patient's still having symptoms, I offer them the option of carpal tunnel release. There's two common ways that we approach this. We can either do an open carpal tunnel release or an endoscopic carpal tunnel release. I like to use the endoscopic carpal tunnel release, and essentially I make a small incision proximal to the wrist. I use a camera with a blade on it to look at the ligament that's compressing the median nerve, and then I'm able to release it from that small incision. In terms of postoperative expectations, in general, the only thing that we're waiting to heal is the skin, which takes about 10 to 14 days. However, as soon as the surgery is done, you're allowed to return to work and honestly return to any activities that you feel like you can tolerate. If you or anyone you know are experiencing these symptoms, please schedule a visit with me at Alabama Bone and Joint Clinic.